Hello and welcome to Navigating Job Accommodations, a continuing education program from the Southwest Wisconsin Library System. If you haven't already, please edit your name so it reflects what you'd like to be called. And if you like, you can add your preferred pronouns. My name is Shauna Kasegi, and I am the Outreach and Continuing Education Consultant at the Southwest Wisconsin Library System. I use she, her, or they, them pronouns. Today's presentation will be recorded and you'll receive a follow-up email from me with slides and other materials. I am thrilled to welcome Jose today, a consultant from the Job Accommodation Network, commonly referred to as JAN. JAN is an incredible resource and service. I can tell you that I personally found it helpful in my life as I considered what accommodations might help me feel more comfortable and capable of doing my job. So this resource not only helped me brainstorm ideas, but helped me have a conversation with my employer about accommodations. So thank you all for being here today to learn more about JAN. And just so you know, we're going to save questions for the end of the presentation. And I welcome you to use the chat or the Q&A button, and I'll be keeping track of them for you. And with that, I will pass it over to Jose.
Good afternoon. My name's Jose, and I am a consultant for the Job Accommodation Network. And I'm going to talk about how to navigate the accommodations process with the Job Accommodation Network. So kind of like going over, there we go. So I'll give an overview of what JAN is and what we do, provide some common questions that we often get to each of our teams. I'll go through the interactive process. I will not be giving a tour of our website, just so that we do have time for questions. And then at the end, I'll be taking questions. Okay, so I'm going to talk a little bit about what JAN is. So JAN was established in 1983. Initially, we just worked within the federal sector, so providing similar services to what we do now, but just for federal employers. And we are a national and free consulting service, so anyone can access our services free of cost. We provide expert, trusted, and confidential guidance related to job accommodations and other types of issues that are related to disabilities within employment. And we are a service of the U.S. Department of Labor's Office of Disability Employment Policy, or ODEP. So we are a trusted partner in the accommodation process, and we have consultants that we're divided into different teams. So there's an ADA team, which handles questions about the ADA itself. We have a cognitive neurological team, our motor team, the sensory team, and we do have a consultant for self-employment. And we provide practical guidance and technical assistance for employers, people with disabilities, and others related to the actual accommodations process. So solutions for accommodations that could be provided. Title I of the ADA, which is the part of the ADA that handles employment specifically, and as well as providing information on self-employment and entrepreneurship options for those with disabilities. So when it comes to employers, we work with employers of all types and sizes, and we provide our confidential one-to-one consultation related to accommodations that they can provide in the workplace, how to handle the accommodations process, and Title I and other legislation. And we do not provide any legal advice or advocacy, nor do we have the authority to enforce the law. And that goes to anyone that contacts us. We can provide guidance and information, but nothing we say should be considered legal advice or guidance. So for individuals, family members, and other advocates, we provide the same type of information, but just from the other side. So it's more about talking about how to request and negotiate accommodations that the individuals are requesting from their employer, what types of accommodations they could request, and as well as just basic information related to what is within Title I of the ADA when it comes to employment. So when you contact Jan, you can call us at our toll-free number. You could use our live chat on our website, or through our website, you can also send us an email. From that contact, a program assistant will connect with you, and we typically need some information related to the health condition, disability, or limitations that someone about what that person is calling about, since that does help us direct it to the appropriate team, as well as what specific question someone needs assistance with. And then from there, that will be transferred to one of our consultants, where we can talk about the accommodation process, solutions, and provide that practical guidance. So next, I'm going to just tackle some common questions that we get. So for the motor team, we get lots of questions related to ergonomic chairs. And when it comes to ergonomic chairs, something that is important to remember is just remember the basic principles of ergonomics. So while someone may have a chair that is appropriate and ergonomic, there might be other things in the environment that might be causing that problem. So is the desk at the appropriate height? Are the monitors too high or too low? Where are the keyboards located? Those kinds of things. If a more specific chair is required, we always suggest speaking to the employee to know exactly what they need. And this goes for any type of accommodation. So does the chair need armrests? Do they need additional padding? Do they need footrests because the individual's feet don't reach the floor? And an employer can ask for some information to substantiate why that specific chair is needed by relating it to the disability. So in kind of the same line when it comes to computer use, often when it comes to motor impairment, someone might need speech recognition because they might not be able to use the keyboard or mouse effectively. So speech recognition software can have issues with certain types of programs. So considering if it would actually work for the programs that the employer uses is something that has to be really considered, as well as making sure that the employee is trained in the accommodation that is going to be provided. So if someone is receiving speech recognition software, they need to know how to use it for it to be really an effective accommodation. And as well as considering if there are other types of input devices that can help someone use a computer without having to use their hands. So there are, say, cameras that can track head movement or eye movement. There are mouse. There are mice that could be used, but with someone's feet, as well as pedals that can function as buttons. Something else that the motor team does provide guidance on is related to GI issues. So restroom access is something that they often see. So accommodations related to that we often get is, you know, having someone move their workstation closer to a restroom or allowing them to use a private restroom nearby. That's often very helpful for individuals. And having a more flexible schedule if they do have to use the restroom very frequently so that they're able to make up that time if, say, they have a certain amount of break time that they can use, and sometimes that can go over what an employer normally allows. And as well, if the job is compatible, working from home can be a very helpful accommodation to consider, since in that kind of situation, the employee is far more in control of their environment and comfortable in their environment to be able to manage their condition. So questions that we often get for our cognitive and psych team can relate to stress intolerance. So if someone is having stress or anxiety triggered in the workplace, one of the most important things is to figure out what is triggering that stress. So that way, accommodations could be provided to help manage that stress. Sometimes, if a specific type of duty is affecting that stress, if it's something that is a marginal job function, that might be able to be traded with another employee, so that the particular individual doesn't have to, be involved in that particular trigger. Um, so, but if it turns out to be an essential function of the job, and there really aren't any accommodations that could help manage that stress, and this is looking to other accommodations besides trying to change or remove that duty, then reassignment could be considered, because if someone can't perform an essential job function, um, with or without an accommodation. So if there isn't an accommodation that can really be provided, then that employee is likely no longer considered qualified for that job position. So in that kind of situation, looking at if there are any other vacant positions that the employee could be moved to that they are qualified for, would be that final step. We get a lot of questions related to service animals. And under Title I, service animals are treated completely differently than they are under Titles II and III. So a service and emotional support animal could be a form of accommodation, and they are treated and reviewed like any other type of accommodation. So there aren't any specific definitions as to what a service or emotional support animal are under Title I. And because of that definition being really broad and them being considered like any other type of accommodation, it can cause some issues when they're being requested, because even though they shouldn't be treated differently, they still are. So, and an employer should be, and sorry, an employer should be able to allow the service animal to perform the task that it is there to do, without it being a disturbance or affecting um, the job and the work area. And Title III of the ADA, like I mentioned, handles service animals differently. So if where someone is working would be considered a public space, then really looking at those additional Title III obligations and regulations can come into play, because Title I only really covers the areas where only employees are. So leave and scheduling modifications is also something that we get very often. So ADA leave is not the same as FMLA leave. And it doesn't have a set amount of time designated. So with FMLA, an employee would have 12 weeks available. Under the ADA, there is no amount of time that has to be assigned. But that doesn't mean that an employee could ask for indefinite leave either. And a flexible schedule is also another way of helping someone be able to manage their condition or go to appointments, by allowing the individual to make up their time or use intermittent leave as a way of covering that time. So when it comes to the sensory team, we get a lot of questions related to allergies. And allergies, we have the way to handle allergies and accommodations. There are three general ways of handling them. The first one is by removing the allergen. So after you've identified what is causing the allergies and what the employee is reacting to, changing that product, removing it. If it's, say, dust, for example, increasing the frequency of cleaning to just get the allergen out of the environment. The next step would be remove the employee from that area. So changing where someone's workstation is, having a fragrance-free zone within within the workspace, so that there are no external fragrances in that area. Allowing telework is also another option if really those allergens can't be removed. And the last one is trying to reduce exposure as much as possible. So there we would be looking at providing air purifiers, taking breaks away from the area, modifying a schedule if the allergen is coming, say, from a specific process, or certain cleaners and cleanings are happening at certain times. Hearing aids and phones is also something that we commonly are contacting for. So when it regarding hearing aids, it is very important to understand what type of hearing aid someone has and what features that hearing aid has, because that really does determine what types of accommodations and equipment could be used. And whenever someone is contacting us, that is something that we usually ask for, because that really does determine what types of accommodations we can suggest. So, for example, if a hearing aid is Bluetooth compatible, then having a Bluetooth streaming device to connect to the phone so that the phone just goes directly to the hearing aid is something that would be very helpful. But if it doesn't have a Bluetooth feature, then you would have to look into hearing aid compatible headsets so that someone would be able to use that phone receiver without getting a lot of interference. So with vision and computer monitors, often people might request large monitors or sometimes external screen magnifiers, but that might not be a long-term solution, particularly if someone's vision is progressively getting worse, as well as external screen magnifiers aren't really something that is extremely common these days. But it could be very helpful to adjust settings in the computer system itself to increase the size of what is on the screen, as well as using screen magnification software, such as Zoom text and screen reading software like JAWS, often in combination can be a very effective option that should be considered. So talking about the interactive process itself now. So this is our sample interactive process. There isn't anything specific that says what the different parts of the process is. While it is mentioned in EEOC guidance, it isn't something that is required by employers to have or engage in, but it is highly suggested as this is likely to produce the best outcome when it comes to accommodations. So the first step is recognizing that a request has actually been made. You should really err on the side of caution because there is if there are too many delays within the process, that could lead to violations of the ADA. And employers really should avoid that. So if an employee comes even verbally to an employer or a manager, and it's something that sounds like it could be an accommodation request because a disability or a medical condition was mentioned, it should be considered as an accommodation request. If later on it isn't, then it could be considered just as normally. But typically, if it looks or sounds like an accommodation request, then it likely is. So, like I mentioned, acting quickly once that request has been made. So assigning responsibility as to who handles those requests, as well as conducting training with management and employees so that they are aware of the process and accommodation request as a whole. So in this example, we have an employee who has been on FMLA and she notified her employer that she will be needing additional leave to recover from knee surgery after the 12 weeks of FMLA has run out. So is this an accommodation request? It is. The reason why is because leave, which is a form of accommodation, is needed past what's already offered by another federal law. And because a specific medical condition has been mentioned, in this case, the employee was already on FMLA. So if a request for accommodations comes out of an FMLA request, it is very likely that it will be an accommodation request under the ADA. So the next step is gathering information. So the most important part is being able to understand the limitations that the employee has. Under the ADA, an employer could ask for a specific diagnosis, unless there's a state law that would prevent an employer from doing so. But typically the diagnosis itself isn't going to tell you a lot about what the employee is having problem with. And an employer can request medical documentation from a medical provider, but if there is something that the individual can explain, it's easier and faster to ask the individual to explain that than having to go through this process of contacting the doctor or having the employee contact the doctor. And an employer should always consider that there are rules regarding to medical inquiries set by the ADA. So while an employer can ask for certain documentation, there are things that an employer really can't ask for during the process. So an employer can request medical documentation if the disability is or the need for the accommodation is not known or obvious. So, say for an example, someone that uses a wheelchair is requesting an accommodation for a portable ramp that can so that they can access a certain part of the building. In that kind of situation, an employer likely can't request medical documentation because a disability is obvious, as opposed to, say, someone that's requesting leave time or extended leave because of depression. In that kind of situation, that's not necessarily something that's obvious. So an employer would be able to gather some information. And the information that the employer really needs is to know that there is a disability and that the condition meets that definition set by the ADA, which is an impairment that substantially limits one or more major life activities. And that can include work itself as a major life activity. And the ADA does set confidentiality rules. So while the employer is typically not covered by HIPAA, the ADA itself states that any medical documentation that the employer does get be kept confidential. So it isn't something that they should keep in, say, a personnel file. So an example we have here, it relates to service animals. So a newly hired custodian uses a service animal to alert her that a seizure is coming on. The employee did not discuss this during the telephone interview and thought that it would be okay to tell the supervisor on her first day of work. And the employer has a no animals policy, which is something that's generally unwritten when it comes to bringing animals into a workspace. So, was all the information provided? No. The employee didn't state what problem there is in related to work, and there's currently no medical justification for them having their service animal with them. So exploring accommodation options. Keeping an open mind is something that's very important because there's no specific list of accommodations or what would help a specific individual. And sometimes what works from one individual doesn't work for another. So what an accommodation can look like can really vary. And the individual should feel welcome to suggest their own options, because they're really the ones that would know best as to what can work for them in their job. And while an employer could request options and ideas from a medical provider, um, they often aren't the most knowledgeable as to the employee's actual work and what would work the best. So they could present some ideas, but the employee generally would know what would work the best. And as always, you could utilize our services at Jan to see what options could be available. So the example that we have here is a social worker with the use of only one hand requested a work-related assistant to perform keyboarding tasks while entering case notes. And sometimes having an assistant or a typist, type the information for an employee could be a form of accommodation. But how do we know that, if there's anything else that might work? So in this case, contact Jan. Some of the options available in this situation could be to perform an ergonomic assessment to see if there is anything that could be changed in the environment or products that could be provided to help in the situation. Purchasing speech recognition software could be another option, so that way the employee doesn't need to use a keyboard at all. As well as providing a one-handed keyboard or a foot pedal mouse. Those could be other options to help the employee in this kind of situation. So when choosing an accommodation, the employee's preference should be the given first consideration. So the employee usually will know what is best for them in this situation. However, the employer is the one that ultimately chooses what they're able to provide. And the employer can provide another type of accommodation as long as it is effective. And something else, a trial period for an accommodation could be considered to see if this accommodation could actually work and is something that could be provided in the long term. So for this example, we have a customer service representative with diabetes had a strong body odor that could not be reduced until diabetes was under control. He requested to work from home as an accommodation, but the employer was considering putting up cubicle walls and an air purifier in the work area. The job could be done from home, but the employer was concerned about isolating the employee since they would be a work apart from the rest of the workplace. So how should the employer decide which accommodation to choose? Talk with the employee. Often just having a brief discussion with the employee about the accommodations can give you a lot of information. So the employee was the one that put forward that they work from home until their diabetes is better managed. So this isn't a situation where the employer is forcing the employee to be, away from the workplace. And in these kinds of situations, often employees can be considered how they might be perceived at work. So having them being in a cubicle by themselves with an air purifier could draw attention to the situation, which is something that the employee is trying to avoid. So implementing the accommodation, you have to look at that all the steps were followed to be able to implement the accommodation. So aside from just getting the accommodation and providing it is, can the employee use this accommodation? And only essential personnel should be informed about the accommodation. So even at a certain level, managers and supervisors should be aware of what the employee is being given as an accommodation, but in some cases, they might not need to be aware as to the condition as to why the employee needs it. And establishing a contact point that the employee can go to if there are any issues of the accommodation is also very important so that situations can be addressed quickly. So for this example, we have a secretary with a 10-pound lifting restriction had to get bulk items weighing more than 10 pounds from the storage closet. The employer purchased a small lifting device for office settings. Is that it? No. Um, Once something is purchased, doesn't need to be assembled. Uh, does the employee know how to use it? Do they need, to be trained how to use um, uh, the accommodation, the product that was bought? And in this kind of situation, um, a route of travel might need to be established so that the employee knows where to go to make most effective use of this accommodation, as well as designating that specific area in case other people use it. So the last step is monitoring the accommodation. So this helps ensure that the accommodation is effective because sometimes what we thought was going to be effective isn't, or in the long run might not be effective as the work changes or a condition changes. And specifically for equipment, it might need to be repaired or maintained as it is used. So keeping lines of communication open between the employer and the employee is very important in case any type of issue were to come up. So this example is an auditor was provided speech recognition software as an accommodation a year ago. Recently, the employer purchased a new database software, only to find out that the employee's recognition software would not work with the database. And this is something that frequently happens. So how could this problem be avoided? You have to consider what you're buying and if it would have any types of accessibility issues for individuals with disabilities. And along with that, you can't forget about existing accommodations and what's being provided because that sudden change might cause issues if, it's something that isn't being considered alongside other accommodations that might be in place. So here are some ways that you can contact us. You can go to our website at askjan.org. You can call us at 800-526-7234. You can always use our live chat at askjan.org, or you can send an email to jan@askjan.org. You can also find us on social media. On Facebook and LinkedIn as the Job Accommodation Network, on X, formerly known as Twitter, at Jan, and on YouTube at Jan Information, where we do put up our public webinars, trainings, as well as other videos that we have available related to the accommodations process. So now I'll open it up to questions.
Thank you so much, Jose. What questions do folks have? That was a lot of amazing examples. I really liked how you laid that out for us. I'm wondering if people have experienced anything in their workplace that they didn't know how to handle. And this could be like, you could be a boss, a manager, or you could just be a worker working. Mark says that Ask Jen is an amazing resource. Yeah, it is. I've been hearing a lot about it lately, and that's been really interesting and cool because I feel like the word's spreading. So maybe it will spread even further today after y'all move forward with your days. Lori says, how can you keep track of accommodations for future supervisors?
That is something that can be included in that confidential documentation. It's not uncommon that when there is a change in management, there could be issues with continuing the accommodations. And that sometimes still happens even if things are documented just because of other workplace reasons in those changes. But there's nothing that says that that information can't be, kept. And typically we would suggest to keep it in some form of written format so that if there were changes in management, that is still communicated. And if there is a change in management, human resources or whoever handles the accommodations should directly communicate that as well.
Great. Another question, what types of fees are connected with consulting with Jan? Thanks, Diane.
What was that? Sorry.
Yeah, what types of fees are connected with consulting at Jan?
We are a free service, so there are no fees for contacting us in either by phone, chat, or email.
It's free. And I can say I had such an easy experience just contacting them to ask if they wanted to talk to us. It was really fast.
Yeah, also all of our trainings, anything that could be requested is also free of cost.
Awesome. Yeah, thank you. Well, folks are thinking, Jose, I wondered if I was curious about what resources you end up referencing the most.
Um, what I end up referencing the most is generally the EEOC guidance, because essentially what we do is we take that guidance and apply it to the situations in a bit more of a digestible manner. Also, sometimes things that are made obvious in that guidance, some people don't understand as well. So that is where the majority of our information comes from. Outside of that, we would often in cases that people need additional information, we would refer them to their state's human or civil rights department because we only work at a federal level and we only have so much knowledge about state level laws, particularly if it is in, for example, California. That is a place where we will always suggest reach out to the Department of Rehabilitation because California does have laws that go above and beyond what's required by the ADA. And if a state does have those laws, the law that would apply is the one that gives the most protection. But outside of that, that is the place that we would refer people to the most.
Thank you. I feel like I get questions from folks sometimes who want to provide accommodations to folks that haven't disclosed or brought it up to them, but they're trying to like kind of get ahead of something. And I feel like I wanted to just mention that sometimes it's easy to say like, and if you need any accommodations, let me know. I think it's easy to maybe even miss that because I feel like people might need examples. So that's just a random thing I wanted to put out there that like I think that a lot of people don't know what they need. And maybe if there are examples offered once in a while, that might help facilitate the conversation.
Yeah, that is that goes into the training for employees and letting them know that if they do need accommodations, that is something that they should contact HR manager, those points of contact, because if an employer were to know or think that someone might need an accommodation, an employer can't just provide it or make that assumption, even if it's something that's going kind of into, trying to help someone. In that kind of situation, typically that's seen a bit more with performance situations. So what we often would suggest to an employer is to approach the employee and talk about it just as if it was performance related, and ask if there's anything that they can do to help. Because if there is, that kind of just opens the door for that conversation, because there are very limited situations where an employer could really directly ask an employee about accommodations and if they would need them. And that kind of just falls into the situation where if it is something known or that was already disclosed.
Yes, thank you. I definitely didn't mean to say that you should make assumptions. I just think that, yeah, growing up and working in places, I didn't hear a lot of examples. And I think it's nice to hear that people know of some examples. Angela asks, how might you handle opposing accommodations, where one employee needs something and another needs the opposite? Say maybe sounds or scents in a shared workplace.
Okay. This typically comes up most often with service animals, where someone is requesting to bring their service animal, and say typically someone else in the office has allergies. Or another example, someone might have a phobia of dogs or other animals. That kind of situation, both accommodations have to be handled at the same time, because you can't deny someone's accommodation because of someone else's accommodation. So in the case of service animals, we would look at handling that as an allergy situation. So removing the allergen, that can be difficult because you can't necessarily remove the dog if someone needs it to be at work. But seeing if the person with the allergy can work remotely, or providing dander products for the animal, or providing additional cleanings to remove the allergens. Having different routes for those two employees to take, having them work into locations that are far away from each other, are kind of like the typical ideas in that situation.
That was a great question. What else is on folks' minds? Or have the answers we've provided helped? Otherwise, we can definitely end early today. Thank you so much, Jose. Thank you for your time, and thank you for all these great questions and spending some time with us learning about Jan today. And you'll receive a follow-up email from me with slides and other information, so look out for that. And I hope that you all have a great rest of your day.